I have learned, after years of standing at hospital bedsides and watching families hold their breath, that the moment blood behaves abnormally inside the brain, life can fracture in a matter of minutes, and that is why the distinction between a brain hemorrhage and a brain stroke is not a technical detail but a line that often separates survival, disability, and death. When patients sit across from me, I can usually see it in their eyes before they say anything. The fear that something could happen suddenly, the confusion about words they have heard on the news or from neighbors, and the quiet question of whether they or someone they love might be next. In my medical practice, I have seen how these two conditions are often spoken about as if they are the same, yet inside the body they unfold in very different and very unforgiving ways, and misunderstanding that difference can cost precious time. When I talk about a brain stroke, I am often describing a situation where the brain is slowly being starved. The brain is an organ that never truly rests, and every second it demands a constant, uninterrupted supply of oxygen and nutrients through blood. When a blood vessel becomes blocked, often by a clot that has formed elsewhere or developed over time within a narrowed artery, the brain tissue beyond that blockage begins to suffocate. I have watched patients struggle to understand how something they could not feel happening, something completely silent inside their skull, could suddenly leave them unable to speak, move an arm, or recognize a familiar face. What happens inside the body during this type of stroke is not explosive at first, but it is relentlessly destructive. Brain cells begin to shut down one by one, not because they are injured directly, but because they are being deprived of what keeps them alive. A brain hemorrhage, on the other hand, is not a quiet starvation but a violent breach. It occurs when a blood vessel within the brain ruptures and blood escapes into the surrounding tissue. I often explain to patients that the brain is enclosed within the rigid boundaries of the skull, which leaves no room for expansion. When blood leaks where it should not be, pressure builds rapidly. That pressure compresses delicate brain tissue, disrupts normal electrical signals, and can force parts of the brain to shift in ways they were never designed to tolerate. In my experience, patients who suffer a hemorrhage often describe a sudden, overwhelming headache, confusion, or collapse that feels unlike anything they have ever known, and yet many still hesitate to seek help, convincing themselves it might pass. What deeply concerns me is how both conditions can grow quietly long before the crisis moment arrives. I have seen patients who lived for years with uncontrolled high blood pressure, unaware that every day their blood vessels were being placed under strain, becoming weaker, more fragile, and more prone to rupture. Others lived with diabetes, high cholesterol, or chronic stress, not realizing how these factors slowly damage the inner lining of arteries, encouraging clots to form and narrowing pathways that blood must travel through to nourish the brain. The body adapts in remarkable ways, compensating until it no longer can, and when that threshold is crossed, the consequences are immediate and often irreversible. Many people sitting in front of me describe subtle changes they ignored. They talk about brief episodes of dizziness, moments where their speech felt slightly off, or a hand that felt clumsy for a few minutes and then returned to normal. These are the stories that stay with me, because they reveal how easily the brain tries to warn us before a major event occurs. Too often, these warnings are brushed aside as fatigue, stress, or age. Patients tell me they did not want to bother anyone, that they assumed it was nothing serious, and that quiet dismissal can be the most dangerous response of all. The emotional weight of these conditions cannot be separated from the physical damage they cause. I have watched strong, independent individuals struggle with the loss of basic functions they once took for granted. I have seen the frustration in a patient's face when words will not come out correctly, when thoughts are clear but the mouth refuses to cooperate. I have listened to patients describe the shame they feel needing help to walk, to eat, or to dress, and the fear that their identity has been permanently altered. These are not just neurological events. They are deeply human experiences that ripple through every aspect of a person's life. When a brain stroke caused by a blockage is not treated quickly, the affected brain tissue dies. That loss is permanent. The brain does have some ability to adapt, to reroute functions through other areas, but there are limits to that plasticity. The longer blood flow is interrupted, the more extensive the damage becomes. I explain to patients that time is not just important, it is everything. Every minute that passes is a minute where more brain cells are lost forever. This is why sudden weakness on one side of the body, difficulty speaking, facial drooping, or confusion should never be ignored, even if symptoms seem mild or transient. A brain hemorrhage carries its own set of dangers that extend beyond the initial bleed. The blood itself irritates brain tissue, causing swelling that can worsen over hours or days. The pressure inside the skull can rise to levels that impair consciousness, breathing, and heart function. In some cases, surgery is required to relieve that pressure or repair the damaged vessel, and even then the outcome is uncertain. I have had to look families in the eye and explain that despite everything we can do medically, the brain has suffered injuries that may not fully heal. What I find most heartbreaking is how often patients blame themselves after the fact. They replay moments they ignored, appointments they postponed, medications they stopped taking because they felt fine. I always remind them that denial is a very human response to fear. The idea that something catastrophic could happen inside our own bodies is terrifying, and avoidance can feel safer than confrontation. But I also emphasize that knowledge is not meant to frighten, it is meant to empower. As our conversations deepen, I slowly guide patients toward understanding that while we cannot control every risk factor, many aspects of brain health are within our influence. Managing blood pressure consistently, not just when it feels high, protecting blood vessels through balanced nutrition, addressing chronic stress, and taking prescribed medications as directed are not small, insignificant actions. They are daily investments in the integrity of the brain's delicate circulation. I am careful not to present these steps as guarantees, because medicine does not deal in absolutes, but I speak honestly about how dramatically they can reduce risk. When it comes to treatment, the paths for hemorrhage and stroke diverge, and this is another reason the distinction matters so much. A clot-related stroke may benefit from medications that dissolve clots or procedures that physically remove them, but these treatments are time-sensitive and can be dangerous if given to someone who is actually bleeding. A hemorrhage requires a completely different approach, focused on controlling blood pressure, preventing further bleeding, and managing swelling. I have seen outcomes change entirely based on how quickly the correct diagnosis was made, and that reality underscores the importance of rapid medical evaluation rather than waiting to see if symptoms improve. Emotionally, recovery is often a long and uneven journey. Patients may experience depression, anxiety, or a sense of grief for the life they had before. These feelings are not signs of weakness. They are natural responses to trauma and loss. I make it a point to address mental health openly, because ignoring it can hinder physical recovery. The brain heals best when the person as a whole is supported, understood, and given space to adapt. As our conversation draws toward its close, I often pause, allowing silence to do some of the work. I want patients to sit with the seriousness of what we have discussed, not in panic, but in awareness. The difference between a brain hemorrhage and a brain stroke is not just academic. It is a reminder of how vulnerable and precious brain function truly is. I tell them that recognizing symptoms early, respecting the signals the body sends, and seeking help without delay can alter outcomes in profound ways. I want every person listening to understand that knowledge does not remove all risk, but ignorance almost always increases it. The brain cannot speak for itself in words, but it does communicate through changes in sensation, movement, speech, and consciousness. Learning to listen to those signals and acting on them is one of the most powerful forms of self-care available. In medicine, I have seen lives change direction not because of miracles, but because someone chose to pay attention and take timely action. That choice, grounded in understanding and respect for the body, can make all the difference. Image prompt 1. A highly detailed, cinematic medical illustration showing a human brain in cross-section, with one area depicting a blocked artery causing ischemic stroke, and another area showing a ruptured blood vessel with bleeding into brain tissue. Realistic anatomy, dramatic lighting, clinical accuracy, educational yet emotionally intense. Image prompt 2. A realistic emotional scene of a middle-aged patient sitting alone in a hospital room, half of their face subtly weak, eyes reflecting fear and confusion, soft, natural light from a window, medical monitors in the background, capturing vulnerability and quiet anxiety without exaggeration. Image prompt 3. A hopeful but grounded medical scene showing a patient in rehabilitation with a physician nearby. Brain scan images on a screen behind them. Warm but serious atmosphere, symbolizing awareness, recovery, and timely medical care. Realistic hospital environment, cinematic depth and clarity.